Since 2015, Pop Health Podcast has brought to you some of the best minds in healthcare, including leaders from government, not-for-profit, and investor-backed powerhouses, as they share successes, failures, and how our audience can move forward in today's constantly evolving healthcare world. Thank you for joining us for today's episode presented by 24 Hour Home Care.
Hello, everyone, and welcome to another episode of Pop Health Podcast. I'm Gavin Ward, host of Pop Health Podcast. In today's episode, I had the opportunity to sit down with the chief of the Benefits Division of the Department of Healthcare Services, Lisa Murawski. In today's episode, we uncovered the new community health worker benefit that has gone live in July of this year. This has been a benefit that has been a long time coming and has seen success in other states, from the East Coast to the West Coast, but never really has had the robust funding to really excel and thrive here in California. In today's episode, Lisa goes into more detail about this new benefit and how individuals who can relate and connect with their communities can have a big impact in healthcare outcomes. We hope you enjoyed today's episode. Feel free to check out other episodes of Pop Health Podcast by visiting us at pophealthpodcast.com, checking us out on our YouTube channel, or listening to us wherever you listen to your podcasts. Thanks, everybody. Enjoy today's episode. Hi, Lisa. Thanks so much for joining the show today.
Oh, it's a pleasure to be with you, Gavin. Thanks for having me.
Absolutely. So we like to kick off our episodes by getting to know the guest a little bit. So Lisa, would you mind sharing something about yourself, maybe outside of the DHCS world or healthcare world?
Oh, gosh. So I sit on our local school board. so another little part of the identity I have and hats I wear. I like playing guitar. You know, I used to have more hobbies probably before before taking on so much professionally, but those are a couple of things I spend my time on.
Nice. What was the inspiration behind learning guitar? Was it a family member, friend, or someone on TV?
You know, I never had picked it up, but my mom played guitar, and you know, in my late 20s, I thought, you know, this is always something I wanted to do. I love to sing, so it's become a real stress release and a real fun hobby for me.
Awesome. You ever do it in front of an audience, like at a show or a church or?
Really, I'm thinking about, you know, maybe I'll get around to it.
All right,
mic or something.
Nice. That's great. Well, hey, appreciate that. So give us a little background about yourself, Lisa, where you grew up. I noticed you've spent time, you know, in both coasts and internationally. So yeah, a little background, please. Oh,
sure. So grew up in Buffalo, New York, in a kind of, you know, Rust Belt, middle class neighborhood. Was served very well by our public schools in Buffalo. So shout out to Buffalo Public Schools. I came out to California to attend UC Santa Barbara. So did my undergrad in industrial engineering, my graduate work in geography at Santa Barbara. Met my husband there. We moved to Sacramento to start working in policy and politics, and kind of the rest is history. So I've been in Sacramento for about 15 years. You mentioned international living. So I was able to spend about a year studying abroad in Japan and at Tohoku University in Sendai in northern Japan. So fantastic. Just shout out to study abroad programs too.
Yeah.
I recommend that highly. I have two sons myself, and even now, just like thinking about that, that's something that I really want to encourage everyone to do.
That's great. So do you speak any Japanese?
I used to.
Okay.
I just came back from the airport, and my dad was just floored by, you know, I was kind of helping someone get their luggage, and he was like, "Is this my daughter?" But, you know, it's like, if you don't use it, you lose it. So I've lost a lot, but I do miss it. I love the food, the culture, the people I've met there. So.
That's great. That's cool. So you mentioned Santa Barbara. I know off the air I mentioned it. So that was a place for me in my undergrad. I was there, I think, a little bit before your time. Do you recall when you were out in Santa Barbara, any of your favorite food spots, or maybe just spots in general, or what you loved about Santa Barbara?
Oh, well, the beach. I mean, I learned to surf in Santa Barbara. So that was kind of our, I guess, romantic story of my husband and I. We started surfing together, and our future husband at that time. But yeah, I think the beach, just broadly speaking, I lived in IV for Isla Vista
Yes.
for those non Santa Barbara folks. The kind of college neighborhood, real close to the beach, so could walk down or drive down and surf. It's nice to be able to check the surf spots and not have to drive so far to see. So that was really lovely. That was probably my favorite thing. And I just remember coming out from Buffalo and seeing the coral trees in bloom, and just the natural beauty of the place, and just being really really floored. And it started to feel like home as soon as I came.
Nice. Well, I know you're in Sacramento now, so a little bit away from the beach, but still not too far, I guess you can say. So you mentioned industrial engineering out in Buffalo. Actually, before I jump there, so we're recording this right when the NFL season is starting out. Out of curiosity, any connection or love for the Buffalo Bills or no?
I think it's part of my blood. I'm not like a huge sports fan, but if you grow up in Buffalo, it's just part of the air you breathe. So yes, I consider myself a longtime diehard Bills fan, just out of heritage.
Yes. Well, audience, you'll hear this a few days after the Buffalo Bills just really put their stamp on the LA Rams. I'm a LA Rams supporter, and the NFL season just started, but congrats to the Bills. So you mentioned industrial engineering in your undergrad, and then you came out to Santa Barbara where you did your master's program. And at what point, whether it was in Santa Barbara or afterwards, when did you start to see healthcare as something that you'd be involved with?
So interestingly, I came out to Sacramento after my undergrad, worked in kind of transportation demand management for a little while in Santa Barbara. So really, kind of getting people out of their cars, which I loved, and being part of the community that way. I had a little bit of crisis when I was in finishing up my engineering degree, thinking, well, I don't know. I think maybe social science and kind of policy is where I should go. And they said, just finish up your degree. And so I made that transition to kind of social science in my grad school work. And then in coming up to Sacramento, I was really interested in, and what can I do in kind of policy? And I had a really strong analytical and technical background. So went to work for the legislative analyst's office, which was a kind of a great fit for the background and skills and interests I had, and wound up in public health, which I didn't have a background in. And so I really am very grateful. Sometimes life takes you on different roads and twists and turns. And so that was kind of my introduction to covering, state policy, budget, healthcare programs. And what an introduction it was. So I started during the Great Recession, when all of the public health programs were being decimated, but kind of fascinating because, the way the budget was being reduced, every single program was kind of under review, which doesn't always happen, right? So everyone was just really like, what does this do? What is what population does it serve? How effective is it? What is the cost effectiveness? So there were just really a lot of really interesting questions about how we manage and what our priorities are, but beyond healthcare and population health. So that was a really good introduction for me, and I really treasure the fact that I was able to kind of come into this space from the public health, population health lens, because I think it's really given me a helpful perspective, for the work in healthcare as well.
That's great.
I've been hooked since then. So
yeah, that's great. So we really want to focus on the new benefit, the community health worker benefit. So I know for me, Lisa, I didn't even know what that term was. I'd heard like community-based organizations use it and mention, they might have to apply for a grant. And it was just kind of this new, not so big thing. a few years back. Now it's the future is bright. Give us a little bit of background on the community health worker, where it comes from, how it became this new benefit.
Yeah. So, well, I really have to credit, just the leadership of the state, Governor Newsom, Secretary Galley, our director, Michelle Boss, Deputy Director, J.C. Cooper, my supervisor, Renee Mallo, just all the way down the line in terms of the vision and leadership to make this a reality. So, I mentioned, coming at things from a public health, population health perspective. So really I think part of that is understanding, that it's about health. It's not just about healthcare, right? It's not just about delivering a service. It's about what is the end result and what are those things that, beyond what we typically think about in that box of healthcare that really both keep us healthy by, having that integration with the healthcare system, and also talk about things like health behaviors and healthy habits and, the education that people need about their health to really thrive. And so, that vision was made a reality. We had our estate plan amendment approved in July. And so I can, talk you through some of the details of what that entails. But this space has been, as you mentioned, a little bit more underground, grant funded, often in the public health, local health jurisdictions, community-based organizations. It's not really been something that's broadly been funded through kind of the insurance reimbursement healthcare delivery system, right?
Yeah.
So introducing that, there's always some tension and growing pains, as in terms of kind of melding those things together. But I think, been able to work with our stakeholders who have been fantastic at really educating us, what are those key components? What are those key competencies that you would need to have? How should the benefit look and be structured? So just, I think, we've gotten to a very good place, and look forward to sharing more details with you.
Yeah. So the community health worker, for me, like if someone asks me what a community health worker is, I don't have much to say. I might say, oh, it's someone who might be boots on the ground in the community, speak the same language, have their own circle of support in that community, and have the ability to influence the community, maybe more so than someone, in an office setting that's coming from like a corporate or government lens. But that's about all I know. Would you mind sharing more details? And like you mentioned the structure and so, yeah, please share more.
Sure. So one of the key things that was really driven home by our outreach and engagement with our stakeholders, who I just really can't credit enough of the engagement and information that they brought to bear on this process. One of the thing that they really emphasized was the lived experience, the connection with the community, the relatability from a cultural, linguistic, maybe like experiential lens. So we're talking about folks who have been involved in the justice system, folks who are like the monolingual farm worker community. That community has a long tradition of using or deploying promotores out to kind of bridge that gap. And it's been an issue that we're looking to address in terms of expanding insurance coverage through Medi-Cal to regardless of immigration status. So that's on the horizon. But in this space where folks were not insured, that bringing the community health worker to navigate them into getting care when they needed it and explaining what was available, that was a really important thing. So it really distinguishes community health workers from kind of the clinical team, is that they can be a part of developing like a care plan for that team, for the patient. But it's really they're the patient's kind of connection. They're the glue that kind of holds that patient in and helps them navigate, helps educate them about the system. So we have in our spa, we we identified the main components of what the community health worker would deliver. So maybe that would help, put a little bit more specificity to this. So
yeah, really quickly, sorry to interrupt you.
Yeah.
Lisa. You mentioned in your spa. Now, I've learned what that means over the last year, and I've been in healthcare 20 years. Would you mind sharing with our audience, when you say spa, what does that mean? Yeah.
Of course. So our state plan amendment for community health workers. So our state plan is our contract with the federal government, between the federal government and the state of California. It explains all of the things that we will cover under our state plan benefits. And so you've probably talked to a lot of folks, a lot of people listening know about different pilots and waivers and lots of different ways that things can be covered under the Medi-Cal program or funded. So the state plan is really kind of that core foundation of the benefits we cover across the board in fee-for-service and managed care for generally for all the populations. And there's some little things, the eligibility for different benefits, but that really covers the foundation of what we cover in the program. So anytime we're adding a new benefit like state, like community health workers that's not already kind of defined somewhere, we have an amendment to that state plan. So that's the state plan amendment, and that's what we really engaged folks on around implementing this benefit, is deciding, well, what does that state plan look like? Because that state plan is, again, the contract between us and the federal government that explains exactly what we can draw down those federal dollars for and what the coverage will look like. And the federal government has to approve that in order for us to then implement it within the Medi-Cal program.
Gotcha. So throughout the state is and forgive me if I'm cutting off what you're going to say, but out of curiosity, this community health worker benefit, is this something that here in California, where there's a lot of different managed care plans, providing the care, are they required to offer this benefit or provide this benefit in each county?
Yes. So that's part of, kind of coverage under the state plan as a state plan benefit versus, a waiver program that might be available in certain counties. So every plan, every Medi-Cal managed care plan, and across the board in fee-for-service and managed care is a benefit.
Okay, got it. And is it okay to say CHW benefit, or is that like an acronym?
That's how we've been referring to it. And I should just also clarify that when I say every managed care plan, every Medi-Cal managed care plan. So it's not a covered benefit, largely in the commercial space at this point, but in terms of Medi-Cal, then every managed care plan we at DHCS contract with.
That's great. Really quickly, so across the country, of course, Medi-Cal in other states is known as Medicaid. Do you know if other states are doing this as well, or is California the first to kind of bring it to fruition in this model?
So we're not the first. We hope we're the best, but we took a lot of inspiration from some other states who had approved state plan amendments. So we do have a web page that has a lot of this information posted, so folks can look that up afterwards. Just if you Google DHCS community health workers, you'll find it.
Okay.
And so we do have some links to some of the other states that had already implemented CHWs. So I'll just shout out to some of those other states: Minnesota, South Dakota, Oregon, Indiana, and Rhode Island.
Okay.
We're also working on this benefit. So
nice. So it wasn't just like a cluster. You mentioned folks on both coasts and central United States. So that's really cool. So how do they determine success, or what are the measurements to gauge if this is working?
Yeah, that's a great question. I think that there's some challenges in probably defining that in as simple a way as as some of the other metrics that we have, in terms of who got this particular screening or service.
Yeah.
We purposely, very intentionally, in consultation with our stakeholders, define the benefit in a way that's very broad and fairly expansive. So we talked about that they can do health education to promote the beneficiary's health, address barriers to care. We talk about health navigation to provide folks information, training, support to understand their connection with the healthcare system. Screening and assessment to identify the need for various services, and then individual support and advocacy. So yeah, I think as you can see, with kind of the way those services are structured, it's very tailored to the person.
Yeah.
And so I don't think it will be as easy like to say, oh, this metric, these community health workers are meant to address, lead screening or fall prevention, or, there's a wide range of ways that they can be used, which is part of the, the excitement, I think, of this benefit. That said, I think and probably my managed care colleagues can speak to this a little bit better, but to the extent, our initial phases of rolling out the benefit, they're requiring the managed care plans to sort of show more on like a process basis, like how many folks have you contracted with, like are the services being delivered, and Dr. Paula Bavaria, our population health officer, so she is going to also be more integral in looking at the monitoring, how these are being integrated into the healthcare system, how this interacts with our population health management efforts. And so that will be, I think, we launched the benefit, but I think that is just the beginning of this story of which will play out over several years. And I think you'll be seeing more and more about, how we judge success, how the benefit's going, ways we can, provide more guidance to improve programs that are happening out in the community. How can we get more people enrolled? So I think, first looking at those process metrics, and then really looking at, okay, how is this influencing the care that folks are getting in various spaces?
Okay, that's great. So if someone wants to be a community health worker, are there defined criteria? Is there defined criteria right now, or each plan sets its own? Any feedback there?
Yeah, so we worked real hard to to develop standards that would be, not create a barrier to getting folks, who have been doing this for a long time, to allowing them to continue and to getting more folks in the door, recognizing the importance of those things that can't be taught in school.
Yeah.
In terms of how important that is for the definition of a community health worker, having that credibility, having that relatability, cultural competence. So the way we've defined the standards are, there are a set of core competencies that we've defined in the state plan amendment, but we've been pretty broad about who, what kind of organizations can offer a certificate that includes those core competencies. So we didn't say it has to be from, organization A, B, or C. There's no statewide certification body for community health workers. That does exist in some other states. We don't have that in California. So part of creating the benefit was also defining those competencies and kind of what would we accept as, who can get in the door and bill for services as a community health worker. So they basically have to have one of two things. Okay. They have to have a certificate that meets certain core competencies, or they have to have a certain level of work experience that will get them in the door. And then within a certain period of time, they will have to also, if they come in through the kind of work experience pathway, they will have to also earn a certificate. So the goal is to make sure eventually everyone participating as a community health worker has some formal training in those core competencies.
Gotcha. Could you give
I should also mention just, we have our sister Department of Healthcare Access and Information. They have a whole other effort where they are working to certify organizations that will then be able to offer those CHW certificates. So that's an ongoing multi-year effort. So we were a little bit before that, so we kind of set the stage, but they are taking it to the next level. So within the next, the next coming years, you'll see a little bit more formalization in that space.
Okay, awesome. Are you able to share? I know it's still in development, but like, what's an example of a core competency that someone would need to have to get this certificate?
Oh, sure. So, so those are defined, in the state plan amendment.
Okay.
So,
Okay.
the core competencies that we've defined, and this, we didn't kind of make them up. They came out of a nationwide effort to really kind of try to get consensus around the core competencies in this area. So we were able to leverage that work, which was very, very helpful. So the core competencies, for instance, communication, interpersonal and relationship building, service coordination and navigation, education and facilitation. So those are some of them. Outreach, professional skills and conduct, community assessment. So there are a list of 10 competencies that we said are required to be covered. And most of the current training programs, already cover, most, if not all, of those core competencies. So would need, minimal, hopefully, if any, adjustments to be able to meet the requirements.
Okay, cool. So in development, it's going to be a few years out as we formalize development. Do you know if have there been any success stories that you've heard of? I know it's a brand new benefit, so I don't mean to put you on the spot. Just rolled out in July, but maybe some early learnings or challenges that you've heard out in the first couple months?
Yeah, so I mean, I think there are always going to be challenges, just expected as part of the process when we're trying to integrate, new, non-licensed folks who have been working in a certain space into the healthcare system and really integrate them in a way that that they haven't been before in terms of insurance coverage for the benefit. We don't have at this point it's just too early to have data on how the benefit is, just given the lag in claims and encounter data that we get since the benefit just launched in July. But there is a long history, of use of the community health worker in California in various spaces, throughout local health jurisdictions, health plans like Inland Empire Health Plan has long employed community health workers and contracted with community-based organizations to help, certain populations and so LA County. There's just a lot of success stories of usage of CHWs across the state.
Got it. But that was pre-official benefit with DHCS, so that's a good point. Or too early for the official benefit to hear all the successes, but you've seen them with those other plans. I know IEHP, do they have the largest geography, like square miles in the state, maybe? Well, the county itself, I'm thinking San Bernardino County. Yeah.
It might be true.
Yeah. Okay, cool. Well, Lisa, this is great. I'm really excited. I've known about this term for a while. So to see this come through is really excited. I'm actually going out to the Inland Empire next week to hear someone talk more on this benefit as well. So really appreciate you. I know this was a pretty quick turnaround. And I appreciate your colleague, Kat, for helping put this together. Lisa, if folks want to follow how things are going with this new benefit, is just kind of following through the DHCS website the best way to do that? Or are there any other places folks can kind of keep tabs on these new certificate processes that are coming down the road?
Yeah, so a couple of things. If you want to be in touch with the department, we do have an email address. So you can reach out to us at chwbenefit@dhcs.ca.gov. And that is also linked off of the Community Health Workers webpage. So if you're able, just pull that up. So you can communicate directly with our benefits division that way. And, if it's to someone else in the department, we can also get you in touch with the right folks. Another thing I would just flag for you, it's not launched yet, but I mentioned our sister Department of Healthcare Access and Information. They will be launching a stakeholder process on development of the certification programs. And I know, just because of the cross-cutting nature of Medi-Cal being such an important piece of that, DHCS will also be engaged in that stakeholder effort. So, folks can bring issues there, and I think that will be a great forum for ongoing engagement over the next year or two.
All right, sounds good. Well, hey, Lisa, again, really appreciate you joining the show today. A wealth of information on what's to me a really exciting benefit. Good luck to your boys as well in school, and you being on the school board also. I know you're wearing many professional hats, so thanks for squeezing us in today, Lisa.
Oh, absolutely. It was a real pleasure. Thank you, Gavin.
Thanks, everyone, for tuning in to another episode of Pop Health Podcast. We hope you've enjoyed today's episode, and if you have and want to check out other episodes, visit us at pophealthpodcast.com, iTunes or Apple Music, Spotify, Stitcher, and now YouTube as well. Take care.